So my research project was on teenage pregnancy and contraceptive policy. And just to begin, I'm going to start with a little background. So births resulting from teen pregnancy in the US have been decreasing at a significant rate. The birth control movement in the US began around 1914, and it aimed at increasing the availability of contraception in the US, and that's through education and legalization of different birth control methods. US teen pregnancy rates are highest of all developing countries, although they are now at their all-time lowest rates. The US is still got rates that are a lot higher than other developed countries. And much of the history of change in contraceptive policy was triggered from lobbyists and those fighting for the legality of female contraception and these coverages by the insurance companies. And here's just a couple of graphs displaying teen pregnancy rates in the US. On the right is teen pregnancy rates in the US from 1940 to 2009. As you can see, the birth rate was pretty high for teens previous to the 1960s, when a lot of contraceptives were introduced in the US. Also, you see a spike in the early 90s, and then after that, there's a decreasing trend into the 2000s, and even today, it's at an all-time low, which is really positive thing for the US. And on the left, you can see a graph that displays just how different the teen pregnancy rates are in the US versus the other developed countries like England, Canada, France, and Sweden, where they're relatively the same and in the same range. The US is still above them. So some teen pregnancy statistics. In 2017, there were 18.8 births for every 1,000 adolescent females ages 15 through 19. Births to teens ages 15 through 19 account for 5% of all births in 2017. Nearly 89% of these births occurred outside of marriage. The 2017 teen birth rate was down 7% from the 2016 rate, when the birth rate was 20.3, and down 70% from 1991, when it was a record high of 61.8. So teen sexual education. So referencing this, there is a published research paper by William Marsiglo and Frank Mott called The Impact of Sexual Education on Sexual Activity, Contraceptive Use, and Premarital Pregnancy Among American Teenagers. And the conclusion of the study was there was no significant association found between taking a sexual education course and subsequently becoming premaritally pregnant before the age of 20. And also in the survey, it was found that programs that are based in the clinic environment are the most successful at affecting contraceptive practices that are most preventative of unwanted pregnancy. So the effect of contraceptive policies. So in a research on what exact effect their contraceptive policies can have on the ability for women to obtain the most effective methods, it's clear from the publication from the Jacobs Institute of Women's Health Issues that these findings display that a number of women sexually active who would like to obtain contraceptives are now being able to obtain them, whereas previous to the Affordable Care Act, the available contraceptives are now in options that are proven to be more effective. So they're cheaper for women to obtain, either free or cheap, and they are actually methods that are even more reliable than methods that were previously offered. So in a study of the decline in teen pregnancy, an analysis by Linda Lindberg titled The Understanding of the Decline in Adolescent Fertility in the U.S. from 2007 to 2012, she expands on research of this decline in the teen pregnancy rate in the U.S. And some traits that have been attributed to these declines, or been attributed to the differences in the teen pregnancy rates in the U.S. versus the other developed countries, are that in the U.S., there's lower socioeconomic classes of teens compared to these other countries with the lower teen birth rates. Along with this, results in U.S. teens being less likely to have access to most effective contraceptives. And another factor is the sentiments of the U.S. really differ from these other countries. And this goes for abortions and the way sexual education is taught to students. With studies like these displaying factors in the U.S. that are contributable to higher pregnancy rates than the rest of the world, it gives us a really great understanding of what can be done and what needs to be done to lower these rates. In conclusion, in a country as developed as the United States, teen pregnancy rates have been alarming for years, and it's very positive that there is a declining trend in this last several years, and it's a positive direction due to the increased effectiveness of contraceptives and expanded policy enactments regarding contraceptives. With this kind of information from studies like this, hopefully there'll be more policy changes and mandates on sexual education programs to educate youth while providing options for contraceptives, then rates will continually decrease.